Welcome to this edition of Directors 20 Live. I'm Steve Redd, and I'm here with Stephanie Griese from the Office of Science and Public Health Practice. Stephanie's a medical epidemiologist. Welcome, Stephanie.
Thank you.
How long have you worked in OPHPR?
So I've worked with CDC for 5 years and with OPHPR for 3.
Okay, so you were an EIS officer in North Carolina, is that right?
I was. Mm-hmm.
And tell me what led to you coming to OPHPR after the EIS experience.
So I went into EIS thinking that I was full court pressed about infectious diseases. I loved infectious diseases, I loved outbreaks, I thought I was going to focus on it for my career, but I actually fell in love with preparedness.
Okay.
I had the opportunity to be one of the lead epidemiologists for the Democratic National Convention that was held in Charlotte, North Carolina, and realized I loved it.
Now, I also know that you trained as a pediatrician.
I did.
Did you work in clinical practice before doing EIS?
I did. I worked as an attending in the emergency department at Johns Hopkins Pediatric Emergency Room.
Okay. And how long did you do that?
I just did that for a year after residency.
Yeah.
So it was a very short time, but I loved it.
Okay. Now, I know also, since you've been at OPHPR, you've had, I don't know, maybe at least 3 different jobs, maybe more than that. So why don't you tell us about your, 3 years and you've had a lot of different responsibilities.
I have. So when I joined OPHPR initially, I was the Vulnerable Populations Officer, and that allowed me to focus on children, but also other at-risk populations, and ensure that we were addressing them in our planning and response. As a result of that, I ended up leading the children's health team for the Ebola response.
Were you guys the part of the team about reopening the schools? I remember that being a big
We
issue.
were. We partnered actually with WHO and UNICEF to develop that guidance. And I think that was one of the large accomplishments of our children's health team, getting those schools back open. I'm very proud of that.
Is there anything you would tell a person, I guess, applying to EIS? There's a lot, probably people from training may contact you. What do you tell them about working at CDC?
So I tell them, well, both about the EIS and CDC, that it's a fantastic place to work. You know, people are very passionate and bring a lot of energy to what they do, and that's what attracted me to CDC to begin with. So very worthwhile.
Okay. Well, Stephanie, thanks for joining us today. That's all the time we have. Thanks for tuning in. Join us next time for Directors 20 Live, and have a great day.